Hello friends, myself Dr. Shishir Hemanta Paranspe. I am from Pimpri, Pune. I am a classical homeopathic practitioner and I am working with Lokmanya Homeopathic Medical College, Chinchwad as a lecturer in the Department of Homeopathic Matra Medica. I am really thankful to Dr. Rasar sir from Sangamner for inspiring me for preparation of these videos. The only motto or the purpose for preparation of this video is to inspire the students to read the Matra Medica and to understand the Matra Medica and give the idea to how to remember the Matra Medica, because remembering the Matra Medica it's a big task. So I have prepared my own idea about the medicine and I am putting it in front of you so that it will be useful in your day-to-day practice. So whatever medicines I am going to take or I am going to share, definitely I am not going in details of that medicine, but I am going to give you some idea, the crux, the summary one has to remember for practical purposes only. So let us go ahead. Let us go for first medicine, Eupatorium perfoliatum. As everyone knows, Eupatorium perfoliatum is one of the good medicine for cases of fevers. As a member of Compositae family, along with the other members like Calendula, like Sina, Chamomilla, Ledampal, Arnica, this medicine also carries the theme of injury and sore, bruise feeling all over the body. No, fear of theme of injury and theme of soreness, bruise feeling is the common characteristics which is present in the family members, and this is also present in this medicine. So one has to remember. But what is very important characteristic that one should remember, or that very important characteristic lies in the common name of that medicine, is the common name of this medicine is boneset. Why the common name is boneset? The name is because this medicine, after giving, relieves promptly the bone pains in the fevers. So the common name is boneset. So this is the first characteristic one should remember, that bone pain in all the disease condition, which is the concomitant symptom present in the Eupatorium perfoliatum. It can be a fever or it can be any physical disease. The bone pain has to be there. If it is not there, one should reconsider the prescription of Eupatorium. Now let us find out a few physical generals or few characteristics which are going through and through the medicines. Definitely I am going to talk about keynotes, but let us find out few common things which one can remember and which one can use in practice. So before prescribing this Eupatorium perfoliatum, the another characteristic symptom one should have is that soreness, bruise feeling and aching. As I told you, this is the characteristic of Compositae family. This soreness, aching and bruise feeling should be all over the body, and soreness, bruise feeling and aching in all the disease condition. I repeat, soreness, bruise feeling and aching in all over the body, soreness, bruise feeling and aching in all the disease condition. If it is there, then only think about this medicine Eupatorium. Now about this aching. How is the aching? Aching as if broken. This aching is present all over the body. It is present in head, in especially cases of fever. It is present in eyes, which is present in cases of influenza or coryza, even fevers. This aching is present in the chest, especially with the respiratory complaints, and one has to support with hands the chest, especially while coughing. That soreness which is aggravated by coughing, and one has to support the chest. This is very important for Eupatorium. So this soreness, bruise feeling and aching all over the body, and this aching in different disease condition, one has to remember, and that aching as if broken, which is present in all the disease condition. So it can be present with fever also. So now let us understand one of the very important pathophysiological action or one of the clinical indication for Eupatorium is fever. Indications during fever. I am not going to tell you all the indications during fever, but Very important indications during fever. Again, the bone pain has to be there, soreness, bruise feeling, and aching all over the body has to be there. But what other characteristics one should have for the uh, eupatorium are the characteristic thirst. The thirst for large quantities of cold water and acid drinks. But what is very important is that this thirst aggravates the nausea and vomiting. This thirst aggravates the chill in malaria fever. The very classical characteristic keynote for this medicine is at the close of the chill in this patient, nausea and vomiting of bitter fluids, which is aggravated by drinking cold water, is the classical symptom for this medicine. And one should observe this symptom during cases of fever. Another symptom which is one should remember is perspiration relieves all the symptoms, even fevers, except headache. Headache is not relieved by perspiration, otherwise, all the symptoms are better by perspiration. Another medicine which is pyrogen, which is exactly opposite. Perspiration does not relieve the symptoms. Then, what one should remember as a concomitant symptom during fever, or what one should observe these concomitants along with the fever. As I told you, bone pain is one of the very important symptom one should have. Then classical mourning, classical sadness and despondency along with the fever is one of the very important characteristic. Another medicine, Nux vomica, which is very parallel to this medicine, which has irritability fever during, where eupatorium has sadness and despondency during fever. Mourning is very important. Another medicine is pulsatilla along with the fever. This is highly comparable with this medicine. Another concomitant which has to be present in this medicine is cracks and soreness, especially at the corners of the mouth. Then nausea, which is the another concomitant, the nausea from smell of cooking food, which is also present in arsenicum, which is the parallel medicine which one can compare with. So nausea from smell of cooking food is one of the again a very important concomitant which has to be present during the fevers. So the fever can be malaria fever, it can be dengue fever, it can be any intermittent fever. What one has to remember is bone pain, soreness, aching, and bruise feeling all over the body, the classical thirst, the classical nausea, mourning, sadness, and despondency, and different aggravating factors along with the chills. Perspiration relieves the symptom. Now, this is the picture of eupatorium perfoliatum. One should remember for practical purposes, especially in front of patients. So there are number of medicines which are highly comparable with this medicines are bryonia, gelsemium, arsenicum, aconite, even pyrogenum. How one can differentiate aconite for prescription of aconite? Now these patients are chilly, eupatorium patients are chilly, aconite is also chilly, but the symptom of aconite is its anxiety, is it acuteness, is it violence, is it restlessness. That acuteness, violence, restlessness, thirst, and sensitivity towards the cold differentiates the aconite from eupatorium. Next medicine is bryonia, which is highly comparable with this eupatorium perforatum. But what is different in bryonia? Now, what are common characteristics? That is, eupatorium also has liver affections. Eupatorium also has aggravation by slightest motion, which bryonia also has, and many such characteristics. But the main modality which is different from bryonia is that bryonia is better by cold, where eupatorium is aggravated by cold. Then the sensitivity of bryonia is lacking over here. That irritability, want to be alone, does not want to get disturbed, wants rest ameliorates, pressure ameliorates. This is not there in eupatorium perforatum. Another medicine which is highly comparable with this medicine is gelsemium. But what are the differentiating characters? First is element from, which is present in gelsemium. Then second is dullness, drowsiness and dizziness. These three Ds are present in gelsemium which are not there in this medicine. Definitely gelsemium is the medicine where one can compare that patient has weakness, tremendous weakness along with the influenza like fevers, which is very parallel to this Eupatorium perfoliatum. Then next medicine which is comparable with this medicine is Arsenicum album. But that feeling of insecurity, feeling of anguish, feeling of tremendous restlessness, then the patient cannot rest until the things are at proper place. These are the symptoms which differentiates the Arsenicum album from this Eupatorium. Then next medicine is Pyrogenum. Pyrogenum is a nosode. There are different indications for nosodes. Definitely the restlessness is parallel to this Eupatorium. Definitely chilliness is also parallel to this. But as I told you, perspiration relieves the symptom is the symptom of Eupatorium. Where perspiration does not relieve the symptom is one of the symptom of Pyrogenum. One more symptom of Pyrogenum is pulse. Pulse is improportionate to the temperature, and classical appearance, toxic look of this patient is the differentiating character from this medicine. Arnica is again the one of the important medicine which is highly comparable with this, but the sensitivity of the arnica, touch me not type of characteristic, which is very intensified in arnica than Eupatorium. Arnica has ailments from injury, which is also common, but it also has mental trauma. Arnica is highly hemorrhagic medicine. So these are the different medicine one can compare with this Eupatorium perfoliatum. Definitely, I have not taken all the data. Definitely, I have not compared all the medicines with this Eupatorium perfoliatum. But this is my sincere effort in the form of this video for the all lovers of homeopathy and students of homeopathy, for the purpose that one can remember this Eupatorium perforatum for especially practice purposes. Thank you very much.